Hello, welcome to today's webinar. Our topic today is Get Well, why the Cleveland Cavaliers integrated well health safety at Rocket Mortgage Fieldhouse. Before we get started, I'd like to take a moment to go over a few housekeeping items. My name is Andrew Smizer. I'm the Director of Energy Services with the Greater Cleveland Partnership, and I will be moderating today's webinar. We want to make sure today's presentation is extremely valuable for you, so we ask that you submit all questions by clicking on the question button in the control and typing your question. We welcome questions throughout, so please do submit your questions during the presentation and we'll get through as many of them as we can. Additionally, we are using the polling feature a couple of times today to tailor the presentation. So if you would, try and use the polling feature. Let us know what is your role in the organization. So if you can click on whichever one is appropriate for you. Give you just a couple of minutes to go through that. All right, we're getting some numbers coming through. And a lot of you count as other, so that's interesting to know. All right, we're at 89% voted, so I'll give you one more minute, and then we'll wrap those up. Very few human resources. Okay, good to know. All right, so just so everybody's aware, we're at 32% of facilities in operation, 4% finance, 8% marketing, and 56% other. Today's session is being recorded and will be distributed to all registrants. And now on to our topic, the Well Health Safety Rating. During these times of COVID, the health of our employees, customers, and guests has taken on a heightened focus. Letting them know that you are going to do what you can to make your building and them safe will continue to be key for success long after this virus is gone. The Well Health Safety Rating is one way to do that. The Well Health Safety Rating for facility operations and management is an evidence-based, third-party verified rating for all building types, focused on 5 core areas: cleaning and sanitation, emergency preparedness programs, health services resources, air and water quality management, and stakeholder engagement and communication. Today we will hear from GCP Sustainability Consultants, Emerald Built Environments, to learn how your company can reopen with confidence, and from the Cleveland Cavaliers on why it was essential for them to pursue well HNS at Rocket Mortgage Fieldhouse. Our speakers will be Laura Steinbrink from Emerald Built Environments, Abby McDonald, also from Emerald Built Environments, and Michael Lathrop, Facilities Architect at the Cleveland Cavaliers Rocket Mortgage Fieldhouse. And now it's on to Laura and Abby.
Awesome. Thanks so much, Andrew, for that introduction. And we look forward to getting started. So Abby, I guess you can flip us to the next slide. Thank you very much for taking part in the poll. It helps us to better understand who you are so we can tailor some of our comments to you. Just as an overview, Emerald Built Environments does share and does appreciate the opportunity to be the sustainability consultants to GCP. We have been practicing sustainability consulting for over 13 years based here in Cleveland. We've touched over 375 projects worldwide covering 21 million square feet and have in our portfolio 8 platinum projects. Abby, you can forward, thank you. And what we really do is we work in 2 areas with our clients. We work on strategy and certification, so helping organizations figure out what they want to accomplish with the built environment, either new construction, renovation, or during the operational phase. And we also have a group inside our firm that handles energy services, so we are able to do some of the analysis and testing and verification that is required to measure sustainable performance. That's great. So we'll move on. Thank you very much for having us. And we're going to get into the presentation, but just before we do, we asked you who your role was. And the next question we want to know now is, what your relationship is to the facility that you inhabit. Are you or your organization an owner of that facility, or do you lease your facility? So I'll give you a couple of seconds to figure out the answer to that. I see most so far are owners of the facility. Got 64% voted, so we'll hold it on for a couple more seconds to see if we get that number up at all. Still answers coming in, but it looks pretty much like 2/3 are owners, and that's terrific. Well health and safety and the ARC reentry that we're going to talk about apply to both facilities equally. The way you would approach them might be slightly differently. We've got some evening out here with the scores. I feel like the election at night, it's 58 to 42 now, with 73% voted. So we will just give it a couple more seconds, and then I'll close the poll so we can get back to the presentation. So here we go, 3, 2, 1, closing the poll. Thank you very much for that. And let's go to our first slide, Abby. So why are we here today? Why are we talking about well health safety and ARC reentry? The fundamental thing that we all know, and the data backs it up, 90% of our time is spent indoors. And whether or not you're at home, you're at work, or you're at a learning environment, or perhaps even playing physical activity, your gym, etc., we are dining out, we are indoors. And so being able to really understand what the opportunity indoors to create an environment that feels safe to the people who work in it and who visit it is super important. So that's ultimately what well health and safety is trying to accomplish. So the rating system is intended to build upon what you are likely already doing, be it from your operational policies, the maintenance protocols that you have in your organization, stakeholder engagement. This is about building trust and having open and transparent communications with your visitors and your employees, as well as your emergency planning. Well health and safety is a framework to take what you're doing today, strengthen it, really put it into stone if it's not written down and captured very explicitly in places, and then move it forward. And we'll go into more of the details about the rating system after Michael's presentation. What I'm doing right now is giving you an update on it. So let's go to the next slide. At the end of the day, what we have learned through the emergence of building certifications into the market, which LEED being the most premier of them, having been around over 15 years, is that when there is a third-party designation, you can also think of this like the Better Business Bureau stamp of approval. When they see something like that certification on the door, it gives a sense of calm and understanding that this isn't just you saying you did it, a third party has come in to verify that you have. So let's go to the next slide. Well Health and Safety was released in July. It pivots off of the Well Building certification, which is one of the newer sustainable certifications that is really focused on the health and wellness of the people that occupy a building. And so with the emergence of COVID, it seemed just natural that Well would take its rating system and create a response specific to COVID. And the rating system applies to really any facility type except single family homes. And since the enrollment or the release of the certification in July, 6,800 spaces have enrolled for certification. And let's go to the next slide. One of the things that I think is really important to understand about well health and safety is that it's affordable. So we highlighted on this slide 2 big numbers. If a project is not registered for WELL certification, the master, the Well Building Institute certification, the entrance fee to well health safety is $4,200. If it is a small business, a nonprofit, or a government building, the registration and certification fee is $2,700. So really something that is affordable. And I say on this slide that it's quick. Well health and safety, as you'll learn as we go through this presentation, is about documenting your policies and procedures, collecting data from your stakeholders, and possibly, if you choose, to do optional testing around the indoor air quality and water. So we'll go to the next slide. What this certification process entails, and Abby will talk a little bit more about this later, is a sign up and a customization of your approach. And we'll go through some of the requirements of the certification in a little bit. You gather your documentation, you upload it into a portal, it gets reviewed by the third party. There is some back and forth that goes on to, confirm whether or not you've met the criteria, giving you a chance to improve the documentation. You achieve the certification, and then you are presented with the opportunity to renew that certification going forward. All right, next slide, please. We are going to turn it over to Michael and give you a chance to take screen presentation here to give us a story about why Rocket Mortgage FieldHouse, the Cavs, and the Monsters went after this.
Laura, thank you for the introduction. Once again, my name is Michael Lathrop. I'm the facility architect at Rocket Mortgage FieldHouse, Cleveland Cavaliers, and Lake Erie Monsters. I think that people generally are interested where we landed or where we were at prior to COVID, prior to the pandemic. So I just wanted to take a moment to go very quickly through a series of slides that sort of show in general what the transformation project looked like. And then we'll start talking or start moving into what sort of caused us to jumpstart our involvement with well health safety. So as you can see, like I said, we'll go through these very quickly. Just giving you a general idea, we went through a $187 million transformation of the arena to increase the amount of public space within it, to improve our entry. If you want to go to the next slide, to improve our entry processes, and generally to make the fan experience that much more pleasant. Next slide, please. One of the advantages that we had as a consequence of doing that was that we increased our ability to move people in and out of the arena by increasing the internal floor space. It's obviously, from a COVID standpoint, we were able to address the issues of social distancing and to get us to a place where we had advantages the previous arena did not have. Next slide, please. And we can just continue through these. I think that a few seconds each per slide. Continue. And next slide, please. Okay. Now let's get into the real meat and potatoes of why we went after well health and safety. We have an organizational philosophy that comes down from Dan Gilbert, which is this idea that we do the right thing. And the right thing is not merely doing the right thing from a business standpoint, but it's also from a community standpoint. It's also from a team member standpoint, which are the people that work at the FieldHouse. So this is much more of a holistic concept of doing the right thing. And when COVID happened, we had to look at what impact that has on our ability to do the right thing for our fans, do the right thing for our team members. We can actually blank this slide if you want to. So that philosophy aligns really well with what it is that well health and safety is trying to accomplish. We need to do everything we can to protect our fans and our team members and be able to imbue within them this confidence that there is, that we are taking those steps. And much like this idea of placing a medallion adjacent to the door, we need to show them, and we need vehicles for doing that. And well health safety is one of those. Now, during the course of COVID, there have been a multitude of certifications that have been introduced. Many of them do not have the track record. They do not have the scientific backing. They don't have the wide range of people that have contributed to well health safety that can allow us to have the confidence we're doing what we need to do. So that really is kind of the reason that well health safety is so important to us. So as we started to look into well, we need to look at it from the standpoint of being very strategic. As Laura indicated, you can have many of these attributes that exist already within your organization. And those can be things which exist within the HR team, whether that's mental health counseling or insurance, or promoting flu shots, speaking to other aspects of HR, and then also within that, the facility operations types of things that may be occurring, whether that's augmented ventilation or things like that. But what happens is when you start looking at that strategy for achieving well health and safety, you start to identify opportunities that may exist. Now, one of the things spread out across the 6 different categories and 20 elements that you can achieve for well is that there are things that are going to stretch you perhaps as an organization, that you're going to have to be a little bit more rigorous and have to really pursue in order to achieve it. So as I said, some things may exist already within your organization that make it relatively easy to achieve it. But there are other things, due to its nature as a rigorous, non-fluff certification, that are going to cause you to have to maybe stretch and think about what your strategy is, and then bring your larger team together to help pursue that, such as HR, facility operations, all the different aspects of your team that you're going to need to achieve this. So that's kind of something that I think is really exciting about well, is that, one of the things I have some notes on my wall. One of the things I have there is science exclamation point. Like I said, that this is something that has meaning and is something that you can achieve. And that to me is something that's really fascinating about this. Like I said, not a fluff credential. It's something that's solid, it's rigorous. It causes you to kind of stretch and think about what it is you want to accomplish. Now, there are 15 elements or 15 points that are required out of the 20 to achieve it. You really don't get any extra credit, so to speak, for doing more than the 16. It's probably not a bad idea to think about it, but it's not necessary. One of the advantages we saw is that from a timing standpoint, we were able to structure this so we were able to achieve our 15 points. But there are other aspects of these elements that, as we looked more deeply into them, we realized organizationally we still wanted to pursue them. It may not be as part of achieving the certification, but it's actually something, once again, that stretches you or makes you think about what you can achieve. So even though we went after the 15 points, we also then are thinking about downstream, what are these other things that well has sort of inspired us to think about that we can then achieve as a result? And those are ongoing processes, but it has caused us, to grow actually, as an organization, to be more than what it was when we started the process. So that to me is something that's really exciting. Another thing for you to think about with well health safety is that by having a certification and having a team behind it, what you're going to be able to do is to achieve sustainability of that process. And that's really obviously important with any sort of certification or rating. You need to have that support team that's going to help you carry that forward in the future and continuously improve, because all of these ratings are based essentially upon, as Laura identified, third-party certification. So that this isn't something necessarily that you put on the door and then you forget about it. It's something that demands a certain amount of effort on your part. And that actually is a wonderful thing. So kind of in closing, I guess I would say, we have been really happy to have been involved in this process. It's been exciting. More importantly, I think that we're excited because we're the first stadia or arena in Ohio to achieve it, and we're third nationally. So needless to say, we're very excited. And we're excited to see where this is going to take us and what impacts it'll have downstream. So Laura and Abby, I'd turn it back over to you.
Michael, thank you so much for sharing your experience with this rating system. It was great to hear about the do the right thing mantra and how that linked with the WELL certification, and hear about, there are aspects of it that your organization was meeting, but there were definitely challenges too. So thanks again for sharing. Very interesting. So now I'm going to go into a little bit of a deeper dive of the general rating system requirements and talk about how those of you on the webinar can pursue the rating system. So as Michael mentioned, there is a 15 feature threshold to get the criteria. So you have to meet 15 different criteria, and that's done by uploading different policies, letters of assurance. So for example, a letter of assurance from your building engineer, or some photos, narratives, operations schedules, testing reports, and maintenance reports. So that's how you're documenting all these different criteria. So again, as Michael mentioned, there are 5 different core categories that these criteria fall under, along with an innovation category. So the 15 points, the rating system is very flexible in that the 15 points can be achieved in any way that best meets your organizational goals or your building operations. You don't, for example, have to get a credit in every single category, and there's no prerequisites that you need to achieve. You can pick the 15 that best apply to your goals and to what you already have, what you would like to achieve. I will note there's also this innovation category. So if you're doing anything above and beyond the WELL health safety requirements, you can get some bonus points there. If you have a WELL AP, so a WELL accredited professional on your team, you can get a bonus point. And if you achieve any of the WELL building, so like that general WELL building certification that Laura talked about, you can also earn some points there. So this is a scorecard that here at Emerald we've put together to help organizations set a path to getting those 15 points. You'll see that we've done a little bit of color coding here. So there are a lot of criteria that are policy related. So either drafting new policies for your organization or revising policies to align with the WELL health safety criteria. All of those criteria are these ones highlighted in purple. So there's a good amount of policy related criteria here. There's also 3 testing and assessment related criteria that I will go into in a moment here. So going back to those policy related criteria, as Michael alluded to during his presentation, policies are great because they help you implement these criteria and they help you sustain in the long run. So if you have those policies in place, you have your employees and staff following those policies, you can sustain all of the good benefits of this credential in the future. So for example, there's policies to make sure your cleaning products meet the WELL health safety levels, or for example, to make sure that you're planning for a healthy reentry after an emergency event that the occupants of your building are okay with, that makes them feel safe. Or kind of on the HR side, making sure that your sick leave and your benefits meet the WELL health safety levels. So again, just like when we looked at that scorecard, the criteria themselves are specific but also flexible. So I've put up an example here of the reduce respiratory particle exposure criteria. And you'll see there are A, B, C, D criteria that need to be followed. But within each, you can select the option that is best applicable to your organization or to your organization goals. So we'll look at this first example. You need to select a distancing strategy, but you can select one of the 3 options that best relates to what your goals are or what you see for the future of your organization. A credit like this is verified by a professional narrative. So you would write up exactly which strategies you're pursuing in your building or for your organization, and then provide the communication strategy. So how you're letting everyone know about these different strategies. And then you would upload that narrative to the WELL portal, which I will go over in a moment. This is another example of one of the well health safety criteria. Again, it's specific, but it gives you some flexibility as to letting it meet your different goals or what's already happening at your organization. So this is for select preferred cleaning products. It doesn't, for example, give you a specific list of you have to use these cleaning products XYZ. It says that any products you do use have to be labeled as low hazard or safer by certain ISO standards or by certain eco labels, like for example, the Green Seal label. And any cleaning products that you do use can't meet any of these GHS codes. So they can't, for example, be toxic in contact with your skin, or they can't be known to cause genetic defects. So again, you just have to make sure the products that you are using meet these criteria. And this specific criteria would be verified by a policy or by an operations schedule or a maintenance schedule for your organization. Okay, going back to those testing credits, I mentioned that there's 3 different testing and assessment credits that you can choose to pursue to get the health safety rating. You have assess ventilation and assess and maintain air treatment systems. For those credits, you would have your building engineer or an outside engineer come in, take a look at your ventilation system, take a look at things like recirculation rates or outdoor air rates, do an inventory of the different filtration systems in your building, and then give recommendations. So are there better filtration systems you can use? Is there more outdoor air that can come into your building? Can you run your systems without recirculating air? So they offer you those guidances, and you don't technically have to implement those in your building. You just have to be aware of those recommendations. You have to be aware of the changes that you can make to make your building even safer for your occupants. And similarly with the monitor air and water quality credit, that requires that you test your air quality and your drinking water quality at least once a year for things like particulate matter or total VOC content or turbidity. Again, you're just testing to understand where your levels are. There are no certain thresholds you have to meet that you can't go over, but you need to understand where you are so you can make the changes that you believe are necessary within your building. So as Michael mentioned, having a successful reentry or health safety plan really requires a collaborative effort through all the team members in your organization. The facilities and maintenance team, of course, plays a large role, which it's great that we have a ton of facilities and maintenance people on the call today. The facilities and maintenance provides those technical documents or different testing and tracking that are needed, or things like letter of assurance about ventilation systems. The human resources team, of course, would help create some of those policies that we went over, review those employee benefits to make sure they're meeting the different criteria, and then, of course, promoting those new policies. So making sure the staff and the employees and the occupants know about those policies and follow those policies. Ownership, of course, plays a large role, just as Michael mentioned with the goals of the CAVS organization, making sure that the criteria that are being pursued meet the goals of your organization, meet your mission statement, meet your objectives. And of course, the ownership should also play a role in creating those policies and writing those letters of assurance to show that these policies are going to be followed. Employees and occupants, they would of course consult the human resources team, ownership, facilities and maintenance on certain policies, and then give their feedback either before the policy is enacted or once the policy is enacted, if they have complaints, if they have improvements, making sure that they provide that to the correct person on the team there. And then lastly, once you get your certification, you want to communicate it. So the marketing team would play a big role in communicating that effort and the certification to the occupants of the building and the community at large and the public so that they know exactly what you're doing to make sure that they feel safe in going into your building. So as Laura mentioned, there is an online portal where those pursuing the WELL health safety rating have access. It's pretty user-friendly. You just go through, select the different criteria that you hope to achieve. So you move these over to yes. If you're planning to pursue, for example, the support hand washing criteria, then you upload your documents. which, as we talked about, would be those policies or your photos or your narratives. And then you submit all of that documentation and the credits that you're hoping to achieve for review to the WELL certifying body. So IWBI, who's the certifying body of the WELL health safety rating, would review all your documents, look at your pictures, look at your policies, and then they would let you know if maybe your policies are missing something, if they need a little bit more information to see if you meet the criteria, or if they have any suggestions for changes, and you can go ahead and make those changes and resubmit. Then hopefully, once everything looks all good, you would get your certification. You'd get that sticker on the wall. You'd be able to communicate all of that to, again, your occupants and the public. So this is the online portal for once you've already registered for WELL Health Safety, but you can, if you're interested, go to the WELL certified website and you can take a look at all of the different credits and the criteria within each credit for free. You can just go on there, take a look, see if it's something that you're interested in, see if you meet any of them already, see if there's any you're interested in, giving that effort to meet some of those criteria. So again, it's totally free to log on to the WELL website and look at all those different criteria. So now I'm going to toss it back over to Laura. She's going to talk about ARC Reentry and how ARC can help as kind of a stepping stone to get you your WELL Health Safety certification.
Awesome. Thank you, Abby, for that. So ARC is another online portal. The software behind ARC is also owned by the Green Building Certification Institute, GBCI, which oversees and issues the LEED and WELL certifications. And ARC was designed specifically for existing buildings. So if a building were to be pursuing LEED for existing building operations and maintenance certification, it would be using ARC to achieve that. And so ARC, in response to COVID, developed what they call the Reentry platform. It is also free. It allows you to document and benchmark some of your activities and policies, and it has some what I would call helping hands to help guide the activity. So we're presenting this to you today really for two reasons. Number one, ARC Reentry has great synergies with WELL Health Safety, and some of the activities inside of the ARC Reentry portal will serve as documentation for WELL Health Safety. The concepts are very similar. It also establishes a process and procedure for ongoing operations and maintenance, benchmarking, and data tracking that, should you be interested in pursuing other building certifications for your space, it can help set you up for that. And it presents an opportunity to sort of graphically see what you're doing, which for many of us, self-included, I need to see it to understand it. I can't just hear it or see numbers. So it's really a great resource and tool for organizations. I would say that ARC is probably best positioned for those organizations that are owners of their buildings, but it certainly by any means is open for everyone. So let's go to the next slide. So within ARC, they have survey topics, and these topics may be helpful. So for example, if you are in the marketing department or finance and you want to be a champion of this initiative inside your organization, the surveys may be helpful to engage facilities or another department to help them understand where they are ranking on certain parts of the activities. They're very simple yes, no, or NA questions, and they help you identify areas for improvement and focus. So as Abby mentioned, the WELL website is free and you can go in and start seeing some of the criteria. If you went into ARC and started taking the surveys or distributing the surveys to your team, you might more quickly identify where you could focus, how you might present yourself into that scorecard, and figure out what your strategy would be to 15 points. Let's go to the next slide. And so it also really helps with stakeholder engagement, which is both directly and indirectly required with the WELL Health Safety Rating System. Your stakeholder engagement surveys could give you an understanding today of what you've done and where you're ranking with your stakeholders as far as their understanding, acceptance, and feeling of security. And you can then use it going forward to continue to document and track as you implement new strategies, processes, etc. And it can be sent through a variety of space options. Like we said, it applies to both, the whole building or a certain tenant space or a common area. And you can track both the occupant responses and visitor responses separately. So for organizations and spaces that have a lot of visitors, such as, an organization or space like Rocket Mortgage or the Children's Museum, this type of platform would be really helpful to track some of that engagement. All right, let's go to the next slide. The other thing that it does is it accepts in your testing data. So if you were to pursue any of the optional testing criteria for the Well Health Safety Rating System, you can store that data here and start to get a visual of how performance has been over time. And this is really helpful, again, to document what's happening, to understand where you can need to focus. And for example, if the facilities team is trying different strategies around increasing ventilation or changing humidity levels, they could be using this platform to track the performance in comparison to activities that they've done to change operations. So let's go to the next one. So this is our conclusion slide to bring us right into questions and answers. So if you've got questions and haven't put them into the chat boxes yet, please do that. Just wanted to wrap it all up, and I'll invite Michael and Abby to chime in here too as we turn it back over to Andrew for Q&A. But 90% of our time is spent indoors. And if we're going to have a successful reentry and not be stuck in work from home forever or this sort of nebulous where are we, these certifications can really help you create a strategy and a plan and build that trust and assurance to get you to where you want to go. So let's go to our question slide. And Andrew, you want to take over?
All right. Yeah, thank you, Laura, Abby, and Michael. We do have a few questions, and for our audience, if you have any additional, please put them into the question box, and we will get to them as best we can. First of all, let's ask, have there been any studies or does there exist empirical data proving that WELL certification has improved outcomes?
Abby, you want to take that?
Sure. So WELL, of course, does not say that they have a specific statement that says pursuing the WELL Health Safety Rating System does not, of course, guarantee that it'll, for example, help reduce COVID effects in your building, but they're confident in the scientific data behind everything that they're suggesting that it pushes organizations to get good outcomes, if that helps answer your question. So yeah, it's not guaranteed, but the scientific, just like Michael said, science exclamation point, the scientific evidence behind everything leads to positive outcomes.
Okay.
Yeah,
and Michael, go ahead.
I was just going to kind of piggyback on what you were saying, Abby, is it in the sense that it's being prescriptive, we know that improved air filtration, as an example, it's a great example because the research there shows that as you improve air filtration, you get better outcomes in terms of productivity and absenteeism from your team members. So that is something where there's a causal link that has been demonstrated. But I think that because many of these these things are prescriptive, they're based on science, and then they're not saying that in every situation you will have this result, but the reality is that probably in most situations you'll have an improvement. So just my thoughts.
That's great. Thank you, Michael. So Michael, this one is also for you. So were there significant things that you were not doing that you needed to start doing in order to reach that WELL certification?
Well, I think that we had a really good basis as part of having done the transformation project, especially from a physical standpoint. Our using air filtration as an example, we have probably sub-hospital grade ventilation. Don't quote me on that, but that's more or less the way it's been expressed to me. I think that, as I alluded to, the things that we discovered that we were not necessarily pursuing to achieve well certification, those elements it's caused us to look operationally at what we do and to actually aggressively go after certain things that were not included as part of our submittal. So we were doing many things already, but as I said, there are certain things that sort of caused us to stretch our ambitions in what we were trying to accomplish as a result. Andrew, is that a good answer? Or did I miss the
Yeah, I think that covers that question. And I guess in a kind of a different take on it, Laura and Abby, there's a question of what is the benefit? I mean, we can see what the benefit would be for Rocket Mortgage FieldHouse, where you have visitors coming in the thousands. What about a business or an organization that has a building that really nobody comes to visit? It's just employees. What is the benefit for those non-public buildings?
Yeah, so those type of buildings, I mean, as Laura mentioned, this certification really ranges for every single type of building except for single family homes. So yes, it's very helpful for something like Rocket Mortgage FieldHouse, but it's just as helpful for a commercial building, making sure that employees, for example, have those health benefits, those plans for reentry where the employees feel safe. So there's a lot of specific criteria that are actually more ranged towards those type of buildings where it's just employees. It's not really visitors, you know, you maybe just have a handful of visitors a week coming in. Just looking at those regularly occupants of the building, how to make them feel safer, how to make sure that they are safer.
All right. And so, Laura, you were talking about the ARC program, and is that available even if you aren't registered for WELL? Can people use that to kind of guide their thought process in just moving forward in their building?
Absolutely, it is. And, you know, it just occurred to me that maybe after this, when we, you know, share the link to the recording, Abby and I can put together some links to these websites so that people can go to them. But ARC is free. You can create an account for ARC Reentry and start leveraging some of the tools that are there. Yes.
Okay, great. And you referred to the cost of certification. Are the additional things that you need to do, is there a lot of additional cost in terms of getting the testing and all those kind of things? Like how much of the certification cost is a small or large portion of what it costs to actually do the wealth stuff?
You know, I would love for Michael to give a little voice to that, and then Abby and I can chime in separately for maybe different types of organizations and how to approach some of the other things. But Michael, do you want to give your perspective?
Andrew, would you mind restating that question?
Sure. Like we know that the costs for WELL are not prohibitive, but or for the certification, but in terms of like getting the testing done and all of the other steps that are involved in making sure that you're hitting those criteria, are those expensive? You know, is that a 50% increase in cost? Is it a 5% increase in cost?
Well, I mean, it's a good question. A lot of it is dependent upon the strategy that you're pursuing and what additional testing you might need to do as a result. In our strategy, we only had one situation where we needed to engage a professional engineer, which was a nominal cost. It was relatively minor. I would say that if, you know, we're somewhere talking on the order of magnitude of $1,500. But if you're getting into things such as air testing and water testing, it really is dependent upon the size of the facility that you're dealing with. So if you're dealing with a relatively small facility where you're taking one water test and one air test, or maybe 2 or 3, you're not looking at a significant cost, because we did explore that as well. For us, with 728,000 square foot arena, it would have been something else.
Yeah,
Understood.
Right, I'll pop in on that one, Abby, if you want to back up after me. So the testing criteria are optional. So none, as Abby had said, none of the criteria are required to get to the 15. So you can choose or not choose to do however many of them to get to your minimum of 15 in order to get to the certification. And it really is the cost dependent on elements such as the staff time that might be required to gather and to document the policies and to review and collaborate. It might be calling in the engineer in order to do some calculations or help you understand what your ventilation strategy is today and how it might change. It may be that you want to pursue the optional testing for air and water quality. But I think for this rating system, the abundance of the cost will be in staff time required to capture those policies and put them into play. And whether or not you want to engage, an outside consultant to help you do that or not, there's some templates that could be, leveraged to help sort of direct that activity. Abby, do you have anything else you want to add to that?
Yeah, I would definitely agree with what both Laura and Michael said. So a lot of the time would come from writing those policies. There's also things like if your cleaning crew or your cleaning company has a premium for using green products, or for example, if you're installing plexiglass at your ticket counters, that would be a cost. But these are pretty nominal costs, and they're hopefully things that kind of go with what your organization's trying to pursue anyways. So a lot of opportunity costs maybe with time, some opportunity costs maybe with providing more sick leave benefits or increasing insurance benefits or health benefits. But again, it's very flexible. You can choose the costs that make most sense for your organization.
All right, excellent, thank you. So we have a few more questions. And first of all, yes, this session is being recorded and it will be distributed to all registrants in the next day or two. And another question that we have is, can you compare and contrast WELL to the other certifications like LEED? How do they compare, and what are the differences?
I could take this one, Laura.
Yeah.
So first of all, WELL health safety is what we're talking about today. Completely different from, or very different from the WELL building standard. So the WELL building standard, there's required testing. There's someone that comes out and checks everything. There's a lot more preconditions, so required credits that need to be met. It's a much bigger undertaking. So WELL Health Safety is kind of like a stepping stone to the WELL building certification. WELL Health Safety is meant for those organizations that don't necessarily want to spend the money it takes to get the full WELL building certification. That takes maybe even a year or so to pursue. Like Laura said, you can do it quickly. You can make it meet exactly what your organization needs. So that's the first difference between WELL Health Safety and WELL Building. Then there's of course LEED. So LEED is about energy efficiency, water efficiency. WELL is about human health within the building. LEED is more about the building itself. So looking at the systems in the building, the materials used, recycled content. WELL is looking at how the humans feel within the building. Anything else, Laura?
Well, I would just say that if you are participating or your organization has a building that is being built or under construction and is pursuing LEED certification, LEED specific response to COVID has been the development of what they call pilot credits, which are in alignment with some of the WELL Health Safety credits. So for example, you can achieve an innovation point by doing a COVID pilot credit. There are, if you follow along with Emerald and some of the stuff we've released, there are a couple of other building certifications that have come out specifically to address COVID, the Fitwell COVID response in particular. And Fitwell, like WELL, is focused on the health and wellness of the occupants. And it is somewhere in between LEED and WELL, because it also deals a lot with the site and other sort of design elements of the space. But they're all, the COVID responses that have been developed, or the COVID certifications, are really intended to address specifically the organization's response to the health and safety of the building occupants in relation to, a health event or a critical emergency, and to make sure that you have the policies, procedures, and operational strategies in place to protect the building occupants.
Okay. So carrying on from that, then, if you have well health and safety is focused specifically, sort of, on COVID and how it affects things. COVID, say we get through this sometime early next year, we move on. What is the benefit of well health and safety at that point? And how does it affect or change or evolve as additional, unfortunately, pandemics may arise?
Abby, do you want to talk about the sort of recertification process? And
So the well health safety is actually only good for 1 year. You have to recertify every year. If everything is the same, you can kind of just re-upload the same documentation that you did before. However, I believe every year they're planning to release a new version of the criteria. So I think you can use the same one for a few years. They give you a little bit of a threshold there, but then after a few years, you have to go with the newest version. So they really try to build upon what they've already done, anything new within the environment. Hopefully, knock on wood, we won't have anything new to add in the next few years, but it's definitely, it's not a static certification. They're really planning to update it every single year with anything that's relevant.
All right. Thank you very much for that. So we seem to have gotten through most of our questions that have come through. Do either of the three presenters have anything else that they'd like to add quickly as we're coming to our time?
Hey, Andrew, I feel like I was ambiguous in my response to the first question that was directed at me. So I hate to do this to you. Can you ask me again?
Sure. It was about the significant things that you had not been doing that you needed to start doing in order to get to lead. Sorry.
I appreciate that because I hate giving ambiguous responses. I feel it's it's not the best. But anyway, so yes, we did actually operationally, there's some additional steps that we've implemented in order to achieve the well health safety rating. Part of that is essentially doing a room by room inspection periodically throughout the course of, or several times throughout the course of the year to inspect for water infiltration and mold. So that's an example of something that we were not doing previously. We always relied upon the FieldHouse occupants to self-report. But as a consequence, we're being more proactive in what it is we're trying to do as part of well health safety. And that's an example of one. There are others that are more, more business related that we can't necessarily get into in this forum. But I did want to give a more complete response.
All right. I appreciate that. And I'm sure everybody's looking forward to being able to come and visit your facility again. It's been not many people going through there recently.
We want you back.
All right.
Buildings without people are a horrible thing.
Right.
Andrew, I could pop in on that one, maybe as it relates to the policies and some of Abby and our experience around working with organizations who are pursuing a certification that deals with operations and maintenance, which is a lot of policy procedure and then show me you did it. For well, it's just writing the policies and procedures, but there are some requirements to policies, like who's really in charge and how do you know that it was, how will you know if it's being implemented? What's your checks and balance process? Or what is the process to amend this policy? So some of those elements, which are super important for the sort of the long-term, making sure that you're meeting the goals that you want to do. Like Michael just gave the example, they were doing inspections by way of sort of assuming that if somebody saw a leak, they would, or an area where there looked like there was water damage, they would self-report. Now they're specifically going out and looking for those quarterly, right? And, you know, it would say in the policy, this position is responsible for looking at that area or ensuring that all of the areas are inspected or something like that. So there's some, call them refinement elements that many of the policies we find sometimes just need to be added. Like, you're doing it, but now let's tighten it up a little bit. And that's where it gets into the staff time of having to talk about who's going to actually do it and then getting the sign off and having legal look at it. So there are some hoops, but hopefully it's not too much that it scares anybody away, because it's really about creating that feedback loop to make sure that you're getting done what you say is going to get done.
All right. Thank you very much. So we have, I think, answered all the questions that have come in. I appreciate all your time. Thank you to all of our speakers, and thank you all for attending. If you have any additional questions or are ready to get started on your building, please reach out to the Greater Cleveland Partnership and we can connect you to the needed resources. Again, thanks everybody. Thanks again, and have a great rest of your day.
Thank you.
Thank
Thank you. Bye.
Bye.